Good morning, everyone. We're going to get started in a minute or two, working out our technology here. So bear with us, and we will be starting shortly. And I see we have a number of people still joining us, so we will get started in a minute. Good morning, everybody. It's our weekly Care Manager informational webinar. Happy Thursday. This is Megan O'Connor, and I just wanted to kick off our webinar for the week. We have a number of different presenters that will be covering a variety of topics. And of course, we have many shout outs that we will be sharing and really thanking people for all their hard work and dedication. So without further ado, I'll get us started. And just to let everyone know that Jim and Ann are at a meeting and not able to join us today, but certainly have been well involved in this presentation and also aware of all the great work through the shout outs that we'll be recognizing today. Okay, so today we're going to have an update on training. We all know that there's many trainings going on that people have been involved with, so we're going to try to provide some quick updates. We have some Metasced updates, which I know seems to be our standing topic, and we're really trying to work as well as we can with everyone here to stay on top of some of the glitches and also advocating and working with Metasced to have them addressed in a timely way. We're going to provide an update on the IM assessment. We're also going to do our weekly billing update. We have a few HR reminders for people, and we have Dr. Byron who will be covering a healthcare update for everybody. And we also have some information to share on requests for release of information and a Mindcast reminder, and then of course everybody's favorite shout outs. Okay, so we're going to start with the training updates for care managers. And I'm going to first see if Nancy Shea is connected to us to do the presentation. Otherwise, Lori Liptak will be doing that. So Nancy, are you on? Okay, so Lori wins here. Lori is going to provide some training updates. Go ahead, Lori.
All right, good morning, everybody. First off, the mandatory trainings that are in Litmus, thank you, everybody. Our numbers are actually looking pretty good for where we are. Don't forget, you have until the end of the month to finish those. I am completely and totally aware that there are instances where people are getting halfway through any one of the three trainings and it gets stuck. I have a series of suggestions for people, and I have to be honest, most people have it fixed when they just try again the next day. They've been tested. I don't know if it's the internet. I don't know if it's your Chromebook. I don't know. We've covered all possible avenues, so just take a deep breath and please don't wait till the last minute, because if it glitches for you, it won't happen. But the number of glitches are actually small compared to the number that have been completed. So enjoy those trainings and keep going. And thanks for the great updates. Okay, the next one is Nancy has been creating and developing relationships with the New York START, which is a crisis prevention community response service for people with developmental disabilities. They are located across the entire state, and they offer lots of education and training. These trainings are at no cost, and we will be working with them to bring trainings and make them available to all of you so you can hone in on some of your crisis management skills. First training is going to be offered in Queens on Thursday the 30th, and if you're interested in attending, just check in with your supervisor. Those trainings will be rolled out in other areas too, not just in New York City. Okay, so employee training record. We are still in a very new area as a CCO on tracking and training that we've completed. And if you remember in the MSC world, it was very prescriptive. You had very specific trainings you had to take. You had a training record you had to maintain. That training record had to be presented. But as we're moving into a new company and a new era of training requirements from the state, we're not completely certain what that's going to look like, and nor are all our electronic systems completely set up and ready to go yet, because we're focusing on Metasched. So we are going to be providing to you an employee training record document that we're going to ask that you capture the training that you are participating in and completing, and keeping a running log of that. That includes webinars here, supervisor webinars. We know that regional directors and regional staff are providing trainings for you that we have no idea that they're even going on, because they're running with the show and it's been awesome. But we'd like you to do that, and then those records will be submitted to the training email box, and then we'll keep paper copies of that. So more will be coming on that with exact deadlines and details. That's just a picture of what it might look like. Very simple. Just give us the title, the date, where you did it, who was the presenter, and if keep a copy of any certificates that you might have received, kind of just like you used to do in the old days. So long ago. Old days, so long ago. It was only like 50 days ago. Until we can get all the electronic systems up and completely functioning the way we hope they need to. Oh, Metasched. We all love Metasched, don't we, guys? Okay, so I sent out directions for everybody on how to attach documents into the individual's records and recommendations as to which of the two places that you can attach them. I started getting emails about people who have uploaded them into their own personal M drive on Metasched. Just so you know, you cannot take that document from the M drive and move it to a record. You have to think about it as it is a folder on your computer that you store things in, so you have to pull it out, make it available, then attach it. If you're having problems with a printer and scanning, please contact somebody at your site that can help you get that set up. I don't have the instructions for that yet, but I'm sure there is somebody at location that can help you. And if not, probably email Help Me Too. And if they can't get you the instructions, we at least will get you on a list that you need instructions. But work together on that, please. Locating missing notes. I'll go into this more with a supervisor on the supervisor call afterwards, but if you feel that your supervisor has notes that need to be approved and they're not seeing them, and directions were set out through the regional directors on how you can search in audit note activities by an individual's name, find the note, and then approve it. Please make sure you do that so we have the approved notes for everybody on your caseload. Sorry, I haven't had my coffee yet. It's in my hand, but I haven't drank any. Activity return for correction. We finding that there is a lot of notes that were asked to be corrected, and they're not being corrected, they're still sitting out there. And it's happening for two reasons, we believe. One is that if the supervisor denied a note because the task was incorrect, the care manager cannot yet correct the task. It's not available to do that in Medi-Sched. So it may sit and linger because the care manager doesn't know what to do with it. So talk to your supervisor and work out a plan to approve those and send those through. The other issue we discovered finally this morning was that some of you are not getting your notifications and alerts that you have a denied note. We were under the impression that this was a feature that we turned on globally for all care managers, discovered by email literally 5 minutes ago that it's a person by person by person has to turn it on moving forward. So I'm going to work with the supervisors to provide instructions on how to sit with their care managers and check and do that. Not that you guys need more work, but you're already meeting with them anyway to confirm that that's turned on. We'll work through more details on that. Okay, in-person box. The in-person box did disappear on Tuesday when you were approving the notes. When the supervisor pulls up the note to determine if they're going to approve it or not, the in-person box did disappear and text appeared in parentheses near the task. We did not know that was coming. That was a complete and total surprise as to this cosmetic change, and we appreciate the angst and anxiety it created for you guys not knowing if you should approve the note. But I've talked to different people in here, and they're shaking their head. Yes, it's okay to approve that note because that is now how the system is functioning. Trust me, there have been conversations with Medi-Sched to, in the future, give us a heads up on even some of these small changes. But I have to tell you guys, I am totally floored and impressed by how diligent you are and precise in approving these notes to make sure that you're doing appropriately, correctly, and not creating any Medicaid billing fraud. So kudos to the team out there for being on top of it and being really diligent about approving those notes. So good job, guys. Audit activity note changes. Oh, this morning or sometime today, when you go into the audit activity note report, they're adding 2 more fields that you can search by. One is we can now search by supervisor to see how many notes are sitting out there by supervisor. Or you can do it by supervisors that you manage. The other one should be an in-person checkbox. So if you need to go in and approve notes that are in person, or you want to quickly find in-person notes, that will be there too. I see this in the future as being fantastic because as we start to work on improving our documentation, it's going to be very critical on how we document those in-person and home visits and the details that we provide to them. We can't just say now we went to Johnny's home and met and did, and that's it. It's a great way to audit and find more details. Finally, last one is the sandbox is going to be down for updates 2 to 5 on Friday. I think I put in the wrong number, Megan, sorry.
Okay, 2 to 5. 2
to 5. It's going to be, just figure it's from 2 to the end of the day. What's going to happen is the sandbox is going to be updated to match the coordinate site. So now when you're testing or training, the sandbox looks like where your real production environment. And the hope is that now the developers can go into the sandbox that's updated and do more testing prior to pushing it into Medi-Sched coordinates. So it's a good thing. It's a good thing all the way around. It's a good Medi-Sched thing. Great. All right. I think that's my Medi-Sched.
Thanks, Lori. I think the Lori show continues, though, because the next topic is IM assessments.
Okay. So, to the best of my knowledge, when I left last night, the most up-to-date version of the IM assessment is 20237. I'm going to ask until we can figure out why and when and how frequently they're actually making these updates, that when you log in the morning to the IM assessment, actually shut off the assessment, turn it back on, give it a minute and look, and if you're really feeling energetic, do it twice. I heard this right from the engineer. The engineer of the app said you might have to do this twice just to make sure. That gives it time to upload the most current version. That's all I can say about that. And then today we're going to do the IM training webinar again at 1 o'clock. And we're going to hope and cross our fingers that everything goes perfect for Sarah. It went perfect to the last 5 minutes, which is really good. And we figured out why we think that didn't finish on a big bang. And next week, what we're going to do is we're going to follow this whole process from now you've completed the IM assessment. What does it look like in the life plan and Medi-Sched? And what do you do in Medi-Sched with what populated now to start to wrap this up? So I figured that's probably going to be next week, and then the following week, I'm sure there's going to be something that's going to follow up on that. That's either going to be a documentation review or something on those. Now you go, what do you do with the information in the plan that you finished it? Where do you take it to the next level? And we'll continue on this path.
Okay, thanks, Lori. So lots going on with the IM assessment, and then getting into sharing more information next week with the life plan training. So definitely everybody should make it a point to participate. If you didn't participate the other day in the training, today's webinar, and then the life plan trainings next week.
And they'll be recorded and put on Litmus Friday or Saturday. That's when everything goes up.
Okay, let me try to advance my slide here. There we go. Okay, Venkat, are you on the line to provide us an update on billing?
I am.
Thank
Hi,
you.
good morning, everyone. My name is Venkat Appan. I'm the billing manager. Just want to give you a quick update. This will be brief. Even though I don't have a slide for July, I just want to give you an update. For July, our billed percentage have went up to 89%. And I do see some claims that are ready to be submitted, so our July will be even better. For August, we haven't done so great. We only bill about 52%. Good thing is we have about 6 business days for this month, so we have some time to put these claims in, and certainly we still could bill in September for August, provided that we provide a service in August for these members. So I urge you guys, to process these billing so that we could actually submit the billing to eMedNy. That's all I have.
Okay. Thanks, Venkat. And I'll just, reiterate kind of what you said, that we know there's lots and lots of care management activities going on out there. People really need to get their billable activities in Medi-Sched, and then supervisors, I know, everyone is, fast and furiously going into queue to approve, make approvals to the claims, but we really need to concentrate on getting these numbers up. We actually really did very well, for July, and there's still some things coming through, as Venkat said. So August really, I think we were really counting on August being even a better month, tied to services. People are being, the people receiving care management services, and also our ability to bill. So counting on folks really to crank that out for the next 6 business days, as Venkat said. So that's really the update for that. And thanks everybody for all your efforts, because we know that this has been a challenge, an extreme challenge with some of the glitches with the system and it being a new system. So, we have faith that we will push this forward. Okay, Lisa Reese, are you on the line to provide some human resource updates? Okay, so Lisa, I don't think, was able to connect with us, so we will do a few reminders.
Megan,
first,
I'm here.
Yeah, Lisa.
I'm here. Oh, sorry, I guess I pressed the wrong button. Anyway, I'm here, sorry. So just wanted to offer a few reminders. The 401k plan is up and running. We have several hundred employees that have enrolled in that, which is really terrific. And by enrolling in that, I mean that you're making an election to make a contribution. You do not have to make a contribution. CareDesign will still put 3% in for you on a quarterly basis. But if you do make a contribution, CareDesign will make a matching contribution. So that's the best way to max out on that particular benefit. So this is just a reminder, it's an ongoing enrollment process. If you haven't done it, maybe you put it on a back burner because there's so much going on in the beginning of employment with us, and you say, well, I'll take a look at it later. Get it back out of your email, go to the Vanguard site, really consider getting enrolled in this plan because it is a terrific benefit. So just wanted to offer that reminder. And then the other reminder is around the employee referral incentive. So we are now, I think, about 3.5 weeks into this 2-month period where we're offering the referral bonus. It's a pretty generous referral bonus. We're really looking to have you be delegates and helping us in the recruiting process and helping us find great care managers, people who you would really want to work with and that you think would make terrific care managers in this field. So we just encourage you to continue to think about who you know that would meet our qualifications for the position and send them our way. They can email their resume to Susan Brown, and her email address is sbrown1@caredesignny.org. Or, you can receive their resume and send it to Suzanne. Either way, just make sure that when they do fill out an employment application that they indicate that they heard about the job from you so that we can connect the referral bonus back to the care manager. And then lastly, the last bullet there has to do with the mileage reimbursement, right? So many people did get their mileage reimbursement. I think that went last week. And we had a handful more people who submitted their driver's license information to us. Too late to get that cutoff, but it's going to be processed in the next check. But if you are someone who maybe just haven't gotten around to submitting for mileage yet, and if you haven't provided your driver's license information to Holly Duravajan, Human Resources, please do so as soon as possible. All you need to do is email her your driver's license number. You do not need to send a copy of the license. Just email her your driver's license number. She'll put it in the LENS system, and it'll clear the path for any reimbursement requests that you have. And that's it, Megan, I think.
Thanks, Lisa.
You're welcome.
Okay, Dr. Byron is going to provide a healthcare update for us on preventative care.
Probably could come down here now.
I can usually yell loud enough, but then all you're gonna have to hear me in the room, hear me yelling, so I'm closer to the phone. So good morning. This will be a regular, kind of an introductory subject area that we can do on Thursdays. It's not gonna take the place of a more intensive formal training, and in fact, preventive care is quite an involved, part of a healthcare plan. And so we're just going to do some basics today. When you're developing a plan, you easily can come across acute issues. Hopefully, the people that you work with, the team that takes care of the individuals, is notifying care managers about acute issues. Sometimes this gets skipped. Nurses get notified, other people get notified, but you have to make sure that the folks who are providing care to the individuals that you're responsible for are going to notify you when they go to the ER and there's any other, acute illnesses going on, so you can stay on top of that. The chronic issues are usually, part of a larger plan and usually are then incorporated, somehow into the life plan so that everybody's aware of what those issues are and what the treatment plan is for those issues. But then also another part of that healthcare plan is in bringing it up for that reason is that especially in this era of medicine where we want to look forward and prevent things from happening, there ought to be a preventive healthcare plan as a part of any normal plan that we've developed. We've done lip service in the past to saying that we're going to treat the whole person. We're going to look at every aspect of their life, but now we're really going to pay more attention to doing that. HMOs are making that parts of their plans. We're certainly going to make that a part of our plan. And we're going to also make sure that our definition of a healthcare plan goes beyond, say, you know, a simple test or a medication review. It's going to go beyond, you know, the visit to a healthcare provider's office. It has to include other aspects of people's health that we've talked about for decades, and we're bringing back again as important in somebody's healthcare plan. You know, a yearly physical is maybe where a plan gets put together by a doctor from the outside. We talk about injury prevention, diets, exercise, and weight control. We all do this. It's not just for folks that we take care of. We all are a part of these things. And then some of those old ideas from the past where we include, you know, the need for people to have regular, meaningful activity. They can develop relationships. They have stable finances. They have feelings of security. They have stable housing. They have access to transportation. They have an outlet to manage the stresses in their lives, amongst the other things. Those also are really part of a healthcare plan, which you in your training on developing a life plan have talked about, and incorporating those things in the life plan, and they are part of a healthy healthcare plan also. And it doesn't matter what level of cognitive function people have. Everybody needs all of those elements in their healthcare plan. Some of the most profoundly developmentally disabled folks, non-communicative, need a hug every once in a while. They need that connection to the world. And many times, you don't know it or not, but many people, many of us, are their connection to the world, and they need us in their lives, and they need that connection with us, you know, to feel good and to maintain a healthy life. Specifically, we're going to go through later the general guidelines that are specific, usually to an age-related population, but also have to do, obviously, with somebody's, you know, personal history and their family history and whatever, to go over the kinds of things that we should look forward to and prevent as much as possible, or test for, to make sure that we're going to know when people develop, you know, certain diseases at certain points in their life. We'll go over those things as part of a formal training in preventive health. And again, if you have questions about any of these things, you come across these things in your interactions with doctors, with the healthcare team, whatever. If you have questions about those things, feel free to email me, and we can talk about those things individually even before we get to the training. Thank you.
Okay, thank you, Dr. Byron. And again, we're always looking for suggestions of any health-related training topics that you think would be helpful. If you could let your regional care manager directors know, or email Dr. Byron directly. We really want to be able to focus on what will be most impactful for all of you in your jobs that you do every day. Okay, Lisa Getman, who is our Vice President of Compliance and Compliance Improvement, will be providing an update to us on requests for release of information.
Okay, so there's different types of releases that may come your way as care managers. So we're, just to make it simple for everybody, they're kind of broken into groups. So if you do receive any legal requests, which would be a court order or a subpoena, you should not be releasing any records based on that. You can send whatever you get to me, and then I will review it to make sure that it meets all the requirements, and then I'll work with the care manager with the records that need to be released. Same with oversight and government agency requests, the same process would work for that. If you receive a request for records from other providers, so maybe somebody is going to be getting waiver services and they're asking for documents for enrollment, you know, those types of requests you can release. You do need to make sure that the release of information has the required components, which are the person's name or identifying information such as date of birth, TABS ID. Especially for common names, you want to make sure that you're releasing the correct Joe Smith. It should have a description of the information that they are looking for, who to release the information to, the purpose of the request, the expiration date, which can be a date or it can also be an event. So an event may be, you know, upon enrollment. So until that person's enrolled, then you could release that information until that event. And there should be a signature of the authorized person as well. So you can release the information per the release of information you receive, and you can work with your supervisor with any questions. And, you know, anytime there's additional questions or concerns, you can always reach out to the compliance department, and we can assist you with that. So the same with Social Security requests. I'm sure everybody's familiar with the requests that come from Social Security, so we would follow the same process with that. You know, verify that the consent has all the required information, and then you can release it. Work with your supervisor with any questions. And then the last area that I wanted to touch on is the media requests or questions. So anytime a media outlet contacts you, you should not release any information or answer any questions. We technically cannot even validate if somebody is receiving support from us or not. So in the event that that occurs, please contact me, and I listed my cell phone number on there as well as my email. So you should be able to reach me, but if not, you do want to reach somebody to assist with that.
Okay, thanks, Lisa. I would just add, too, that people should be working and letting their supervisors know if, you know, media reaches out, or, you know, if there's any court orders or legal requests, too, just so that we're all kind of consistent and looped in on handling the issues. Okay, I'm going to give a quick Mimecast update, probably with the assistance of Lori Liptek as well. But we wanted to make sure that people understood how to correctly utilize the Mimecast attachment protection instructions that come through when when we're, you know, emailing and having certain exchanges for information. So this is a screenshot, and the real critical part is the blue side that shows Mimecast attachment protection instructions. So if you're trying to access a document, and this is what you're seeing because of our Mimecast protections, what you do, and we want to make sure people are approaching this the right way, is click on the blue side of the screen where it has the Mimecast attachment. And when you click on that, it'll open up into giving you further instructions. You can, I believe the first option is you can allow the document to come through and trust it on this one situation. And then the second option would be that you could trust that documents from that sender for all occasions. So just make sure that you know, whichever one is the appropriate one, you click on that. If you click on the second option, which is to trust for all future documents, then you will no longer get that Mimecast attachment in the future. So, you know, it's obviously part of our overall privacy, security, et cetera, and we just want to make sure that people are understanding how to access it, because if you don't approach it the right way, you won't be able to get the documents. So, Lori, did you have anything to add to that?
No, you did good. You did well.
All right. Okay, whoops. So we are going to go to shout outs, and we're going to kind of rotate here doing the presentations today. So we have a number, a larger number than we've had in the past. These shout outs really seem to be a popular thing, and something really that I think really helps to showcase all the great things going on out in our offices and out in the field. So starting with a shout out to Ruth Luna Fabian, who has worked extremely hard to assist an individual with significant behavioral challenges. Ruth has had made several hospital visits, worked very late after hours taking calls, collaborated with 5 different entities extensively to assist an individual with significant behavioral challenges to ultimately access an excellent residential school option, which we all know is very, very difficult to do. And the individual's very pleased, as is the parent. So thank you, Ruth. And that's from Dione Torres. And also to the Brucker Boulevard team, who worked together the other day as an entire department because they had to be relocated due to a gas leak. And that really involved 10 care managers. having to, you know, pack up, move, work late, try to bring things with them so that they could seamlessly continue working the next day without delay. So thanks for the teamwork there. And again, that's from Dione Torres. Lori.
All right, this one is for Virginia Schinkel. She has been assisting an overwhelmed dad by conference call and answering benefit questions and making him feel supported. Thank you to Victoria Hawley for submitting that. And shout out to Courtney Kelly Wilson, her persistence in referring and advocacy efforts to secure a new safe living environment for a person she supports. The Ballard Road team members helped with her in sharing ideas, and Danielle for stressing urgency with OPWDD. So great teamwork, and that was submitted from Carrie Woods.
Okay, the next one is to Alicia Birthright, Care Manager Director, and Shiv Kotari for handling a crisis with a person who needed to be removed from his home and to access a safe place to stay. And then after completing numerous emergency applications, coordinating and advocating with OPWD, medical, and other providers, he was placed in an emergency respite program and is safe. So great job. Both Alicia and Shiv worked through this together, although they're in separate work sites. So great collaboration. And Alicia also trained other care managers on the crisis application process. And that was from Louisa Youth-Roche. Thank you. Great job.
This is to Lisette Morales, Long Island Senior Care Manager Supervisor, for compiling a Care Design New York Care Manager Supervisor guide for new supervisors, including step-by-step guides. Information is easily accessible and comprehensive. Wow, that's great to share that.
Yeah.
And that's from Patricia Duran. And then also to the Stony Point team for working together, assisting each other through transition and overall hard work. To Mike Emsworth, who went above and beyond to assist an individual with his job coach, and to Mary Jane for exceptional job with assisting someone with additional hours of CD Pass. And that's from Vladimir Eli, or Eli, I'm not sure.
Okay, some more shout outs. These focus primarily on IT and other assistance. To Natalie Hasco for help with IT issues from Susan O'Brien and Oak Colony Road Stony Point team. To Stephanie Holcomb for assisting with getting documents from Choices when there wasn't the ability, people didn't have the ability to access. That's from Tom Craig. And to Charlene Sanders for developing a particular cover letter to assist in the change from ISP to Life Plan, and that's from Megan Schillinger.
All right, to the Dawson Avenue Site Care Management Team and Sue Manning in New Windsor for covering additional cases during staff shortage. That teamwork was pretty impressive, helping each other navigate these changes. It's never felt more like a team as it does now. From Sarah and Giuliano. Yay, that gave me goosebumps. Yeah. All right, to the Harlem Street Care Managers for patience and adaptability, never missing a beat in the support of your individuals, from Megan.
Okay, to the 48 Scotland Hill Road team for assisting an individual who is very challenging. He has appreciated the team's efforts, has grown in confidence and independence, and this week he took the department out to lunch. Awesome. And to Erica Aristibia, from the entire team, she's a great supervisor, supportive, provides feedback, and always thinks of the needs of the team, and is always available, from Gabby Guest. Nice work, Erica.
Ooh, I'm glad I get this one. Okay, this is to Basaradu, not going to try the last name, Deborah Williams, Christopher Markham, Don Morse, Tatiana, Barb Kirby, Regional Care Manager Directors Rachel, Charlotte, and Laura. So this is a great story about collaboration between the upstate and the downstate teams. So over the past few weeks, members of the Capital District team and the New York City team worked together to meet the challenging needs of an individual who wanted to move from the Capital District to the Bronx. He did not have, and he actually came to the Capital District only within the last, few weeks from Central New York. He did not have supports, was essentially homeless, and needed assistance to temporarily access a shelter until housing and supports could be accessed. After some challenges, the gentleman took a bus to New York City and was met by Basaradu at the Port Authority, connected with HRA and a shelter, and several staff brought him clothing. So this is just a really incredible story of everybody coming together and to collaborate. And this is the kind of stuff that we're happy to talk about versus, you know, some of the other stuff we talked about earlier. So just great job, everyone.
Yeah, I want to also comment on this particular effort, because it's definitely, we all know it definitely takes a village, so it took really upstate folks, many, working with downstate folks. I have to really commend Basaratu for, you know, jumping in, meeting the individual, really helping to advocate and navigate some complex issues. This is actually just one chapter of more challenges I know to follow here. But it really shows kind of a great example of what care management can do and the impact it can have on someone's life, and also the challenges that we all face day to day. So thank you to everyone involved in this, and I know that there's many, many others that we're involved in, and other great things that, you know, maybe haven't come to us for shout outs, but really want to recognize that, because that, as Danielle said, is really what this is about here. Is, you know, supporting people to have meaningful lives. So this is really great work, everyone, and thank you very much. Okay, so we are at the end of our presentation, and I see that we have some questions, number of questions coming through. So bear with us while we try to access the questions.
Click the little box up here. That's the square box next to questions. There you go.
Okay. We have quite a few, so. Okay, first question, will the employee training record form be in the M Drive for us?
We absolutely can put a blank copy up there when it's ready.
Okay, thanks, Lori. Is there a way to have Metasched be able to upload documents from the OneDrive instead of the Chromebook itself? My Chromebook deleted my files, and they all recovered but are unlabeled. So Lori, I don't know if you know the answer to that.
I sent a similar question to the Help Me desk last night and to get some answers, because it was my understanding that you could download from OneDrive, you could pull a document from OneDrive and move it into Metasched, but someone had sent me a question saying that you have to pull it from OneDrive to Google Drive and then move it. So I'm getting some follow-up on that to see exactly how it works, so stand by.
Okay, so we'll provide an update on that. The next question is the training record only for trainings done outside of Litmus, or should we also be listing Litmus trainings? No, it's only for trainings outside of Litmus, and the ones that you're doing through Litmus, we will already have an accounting of. This is just for all the external and other trainings that you participate in, and we will be sending more information out to everybody along with the form. Okay, there's a question about, is there a way that a supervisor can look for notes for a care manager?
Yes. There's a couple different ways. You can, the harder way, the more cumbersome way is you can actually go into the individual's record, click on all documents, or click on the calendar and then search for notes and tasks have been saved that way. Temporarily for now, until the audit note activity report changes, you can actually go in there and search by care manager, I believe, and find those notes there as well.
Okay, so I think to this point, this is something that we'll put some type of instructions together for supervisors, especially now that we're going to be having the update to the audit notes section of Metasched. Okay, somebody had mentioned having problems with not having a working printer to scan documents, so we will have follow-up on that particular situation, and please make sure that your regional care manager director is aware of that as well, but we can certainly follow up because I have the name of the person that submitted that. The next question is, will the training this afternoon be the same as the last one, or are you addressing something new?
Same as Tuesday.
Next question is, was there any confirmation that care managers can continue with doing semi-annual reviews for annual ISP meetings coming up in September? Yes. We are waiting for something in writing from OPWDD, but OPWDD, and we're supposed to be getting it by the end of this week, and once we do, we will certainly share it with everybody, but OPWDD has verbally told us that they're providing an extension on 6-month ISP reviews. So the ability to complete a 6-month review on July and August annual review dates has been extended by OPWDD to include September and October reviews. And we are waiting for that to get that in writing, but that's the update on that question. Sorry, for tiers 1, 2, and 3. Danielle just clarified on that because, as we all know, Tier 4 has its own higher level of requirements, and we don't have that flexibility with the Tier 4s. Okay. Oh, go ahead, Lori.
I was going to say, Megan and Danielle, there are several questions about what happens when somebody changes tier mid-month. They find out that it's changed. What are the face-to-face requirements, and how can the care manager be notified?
Okay. So we aren't supposed to be we're not supposed to be seeing tier changes mid-month. They are supposed to be coming monthly, which of course, as we all know, is hard enough for us to even keep up with when there are tier changes, you know, especially in the direction of someone, you know, becoming a Tier 4 level. So we are supposed to be getting those monthly, and there shouldn't be tier changes in the middle of the month. So if you do have a situation where that, you know, may have happened, please bring it forward to your regional care manager director so we can try to look into that further. And Danielle, I don't know if you have anything to add on that.
I think when people are saying that it happened mid-month, maybe when they discovered it. Because this whole concept of tier changes is sort of new, because August was the first new month that we were in operation since the initial roster came over in July. So I think it's maybe when someone went into, you know, log activity, and all of a sudden they see, oh goodness, this person's now a Tier 4, or their tier changed for some reason. So we know that this creates complications for everyone, and so we do have the capacity to run a report each month at the beginning of the month when the new roster comes over that will notify us of tier changes, and we'll be able to share that out with supervisors, and then, you know, they can share those with care managers so people are aware at the beginning of a month if someone's tier has shifted. But I think, like Megan said, we're trying to work with OPWDD on, you know, so if all of a sudden, the beginning of a month, you find out that somebody on your caseload is now shifted to a Tier 4, and you don't have a Tier 4 compliant caseload, what do we do? And how much time do we have to come into compliance with those requirements? So that's something that we're pursuing, and we just don't have answers on yet, but it really can create a lot of complexities, not only for the organization, but also for the individual and their family, you know, if they're not kind of on board with some of those changes. So those are things that we're trying to work through. But we will be able to run those reports and at least get that out to folks at the beginning of a month to let them know about any tier changes.
Okay. Lori, you do another question you wanted to go
I
over?
do. This one is going to be for Lisa Getman. As there's a request for clarification on the releases of information. Are they only to be used with non-covered entities, or do they need to be completed with everyone? HIPAA should allow us to share information with other providers that we have VA agreements with.
It's going to depend on how the VA is written, which I've not reviewed yet. So I'm going to take that back and get clarification.
Okay.
That's a good question.
That's a very good question.
There's a question about, are there going to be any trainings on how to facilitate a light plan meeting?
I'm sorry, what was the question?
Are there going to be any trainings on how to facilitate a light plan meeting? I think that's certainly something we can add to our list of topics for training. We've been trying to really prioritize around, Metasked, IAMS, light plans, but that's certainly something that we can look at putting together. Okay, I think we answered some of these questions earlier about the ISPs and light plan requirements. For Lisa Reese, if you're still on the line, there's a question about, is it a difficult process to roll over your 403B?
Oh, yes, I'm still here, and I actually did answer that question privately because I thought it was
Okay, great.
unique, but it is not at all a difficult, no, it's fine, for the benefit of everyone, and we've received many, many rollovers, which is great, but it is a really easy process. The form to do that is right in the Vanguard enrollment link. So when you go to the enrollment link, the rollover form is there. They have a helpline that is extremely helpful. They'll walk you through the process of filling out the form, and once you submit the form, the rollover just takes place behind the scenes, so it's pretty easy.
Thanks, Lisa. We have a question about, do we have a status update on Choices Access approval? Christine, I don't know if you have any update.
I don't have any updates, unfortunately. I get a lot of emails from people asking when they're going to get Choices Access, and unfortunately, the only thing I can say is that you need to have submitted your user access request form, and if you have done that, we have sent it over to OPWDD. OPWDD then in turn quality checks it, makes sure it has all the proper elements, and then it passes that on to actually another state agency, which is the New York State ITS. So it's not us and it's not OPWDD that are responsible for actually giving the access. So I just want to explain how that works, but I know that doesn't solve your problem. We have actually seen no progress in additional users being given access in about 3 weeks now. And that's been brought to the attention of OPWDD and management here. And we understand that OPWDD is going to discuss this, hopefully they've been working kind of behind the scenes with ITS to come up with some solutions. And we are told that we will get some more information from OPWDD, and all of the CCOs are experiencing this issue. So they are going to be talking to all of the CCOs about this tomorrow. So hopefully we'll have some additional information. I know it's very frustrating. In the interim, I just encourage you to speak with your supervisor about who else in your area may have Choices Access and be able to look up information for you, or do your supervisor, if they have access, or your director or your regional director should be able to do transactions for you if you need them done. And I appreciate your patience. We're trying to push them as much as we can. We're not able to really have much impact as far as that goes, but we continue to stay on them. So if you do have staff, though, that are new or have not submitted user access request forms, please go ahead and have them do that. We're still sending them over to OPWDD to have them passed along to ITS. I wish I could give you more positive news, but that is the current status.
Thanks, Christina. We'll keep people posted on that as we get any further update. And the next question is, in discussion with OPWDD staff yesterday, they were unable to register to see our documents. Is there a suggestion to offer them? So I did see some emails about that yesterday where it appears there's a Mimecast issue with some of the regional offices from OPWDD opening up our documents. And Jim Brown has gotten involved and is connecting to try to work through that issue. So that should be hopefully resolved pretty quickly. Next question is, the release of information form for us to obtain information from providers is no longer in the M drive. Where is it located?
I'll re-upload it today, but somebody must have just accidentally deleted it.
Okay. So we'll get that loaded in the M Drive today because we know absolutely people need to access that. There's a question about, is there a way to notify care managers when someone changes to Tier 4? Yes, absolutely. We are definitely trying to flag that and as timely as possible work through, notifying people as there's tier changes that occur. We're, also working with OPWDD still on the whole issue of tiers. But it's certainly, a challenge, and we absolutely want to be out in front of it. And our data folks have been trying to run some reports that I think could be helpful to us as well, tied to tier changes.
All right, there is a question that I think has been answered, but we'll ask it again. Someone has DDP2s that need to be updated, but they don't have access. What are the suggestions? There's nobody in their site that has access.
They should contact either, if their supervisor, director, regional director, just go up the,
Keep going up the chain.
Yep.
All right. Is there a way for a supervisor to run a report to check the status of billable activities for each care manager of the month? The progress summary is helpful, but sometimes incorrect. Unfortunately, that is the best way to do this. I've spent a lot of time in the last couple of days pulling samples of those progress reports and understanding where they are incorrect. But when you look at them, I think you should focus on the fact that a task was logged, and you can see that because the tier will be there, and that it's been approved. So as long as the task has been logged and approved, I think we can take it from there to make sure it gets billed until we can get a little bit more confidence in that report.
There's a question about, can we start using the IAM assessment? And yes, you absolutely can. Definitely, participate in Lori's training. I know that some of the directors are also providing different workshops and training, more hands-on, which I think is excellent. So yes, you can use that going forward.
All right, there's another question in here, and I've had it a couple times. If you've already started scanning documents and uploading them in a Metasced and you used a different naming convention, you do not have to delete them all out and change it again. We picked a naming convention in case we ever have to change caseloads or somebody has to go into a record to find it and we know what it is without sifting through documents. So no, you don't have to delete those and start again.
There's a question about, will Litmus let supervisors track completion of trainings for their team?
Eventually.
Yeah.
Litmus does have the capability of breaking and grouping all of the staff by a team. However, right now we don't have a good process to identify, to upload records into Litmus to identify location and supervisory staff to get those teams broken up into teams. So we've been focusing on getting the caseload assignments correct first, but eventually.
Okay. There's a question about, is there any update on whether or not we'll be getting any flexibility with the September 30th deadline for Tier 4 people? At this point, we do not have an update. It's still something that Jim Moran and the other CCOs have been discussing with OPWDD. We do not have an update, and, I think essentially that, we're going to have to focus on the fact that that is a requirement, and I'm not sure that they're going to really bend on that. Okay, there's a question about, when does mileage need to be submitted by to be processed in time for disbursement?
I don't actually know the answer to that. Yeah, I know. I saw that question there, and I'm not sure that there has been a deadline presented. So I think we'd have to get some clarification from finance on that. I don't even want to speculate.
Okay, so we're working, there's a couple questions tied to mileage, so we'll work on getting something out to people.
Great. I have another DDP 2 question here. The team is requesting clarification on who should be updating them. Their DDRO has said that care managers should not be doing them unless just on the waiver the programs are responsible for updating.
You know, I think that, I mean, one of the things that, this is Danielle, that I've mentioned to, you know, to Jim, and maybe that we can do some advocacy with OPWDD around, is that, you know, as far as the DDP2 goes, you know, the old guidance was that each program area should do their own. And unfortunately, what happens with the DDP2 is that the last one in the system is the one that counts. And so whoever's done the most recent DDP2, that's the one that's going to be pulled from to determine tier level, to determine things like self-direction budgets. You know, we just had the experience with, you know, somebody from the agency I came from shifted to a tier 4, we discovered this month, which was surprising to me. I don't know him really, really well, but, and so I went into Choices and looked up and saw that a DDP2 had been entered sometime in July, more than likely from his day program, and, you know, the numbers were significantly different than what was in there previously. So, you know, I think that moving towards, I mean, I know we're moving away from the DDP2 entirely as the CAS assessment is coming in, but to me it seems like it would make more sense the way it's being used now to have a holistic DDP2, but we're not there yet. So right now it is just, you know, it is the last one in, but I think that certainly care managers can update DDP2. I've not heard that they're prohibited from doing that. But it is an area that I think we'd like to see a little bit more, I don't know, guidance surrounding how that process should be implemented based on the fact that the ramifications of the DDP2 have changed a lot in recent months and years.
Okay, there's still some questions coming through about the annual, if there's an annual due in September and October, what does a care manager do? And that ties to the extension that we said that OPWDD has given us, and we will be getting something in writing from them that they're sending out to all the CCOs. So if you have a annual due in September and October, as long as it's not a Tier 4 person, you can do a semi-annual review. So again, for the Tier 4 people, we still have to strictly follow the requirements. You know, and if an annual is due for a Tier 4 person, then that's what we have to, you know, ensure is done. Okay, so we're going to wrap up. There are some other questions that we'll work on getting responses to. There are some things that I think are more, you know, systemic that, you know, we'll work on trying to get out to everybody across care management. So thanks for joining us, everybody, and have a great Thursday.
Bye-bye.
Bye-bye.